Alright, so now we're going to be doing joint mobs. Basically what this is, there's 4 different grades. We are not going to be doing any of them on you today, but normally the grades would depend on what you're feeling, like what pain or spasm or just tightness in your joint capsule that you have. So today we're doing them for the shoulder and the knee. The first thing that we're going to do is the shoulder. We're going to always do it for the inferior and posterior capsule, which are just the back and the bottom of your shoulder. And we're going to do this so we can loosen up that joint space to give you some more mobility and to release some pain. Okay? And so for the first one I'm going to do is I'm going to set up for the inferior capsule. And how I would set it up is I would hold the arm, stabilize it with this while keeping the arm locked in here. I'm going to be grabbing the humeral head with the web between my thumb and my index finger, and I'm going to be, and then I would push downward. Okay. For the inferior, oh, can you scoot this way a little bit? Perfect. For the posterior capsule, what I'm going to do is I'm going to do kind of the same thing. I'm going to squeeze her arm here, stabilize this arm, and I'm going to be right here, right on the, it's right in medial to the joint line, and I'm going to be pushing downward toward the table and keeping my whole arm straight so that I can get better traction with my arm. Okay, so now we're going to be doing the knee, and I'm going to have you bend your knee, perfect, right here. And what I'm going to do is very similar to the anterior drawer, except I'm going to be like, for the anterior capsule, I will be, for the posterior capsule, I'm going to be pressing inward. And for the 4 grades, I'm going to feel the joints, same with the shoulder, I'm going to feel the amount of joint space first, and then we will back off and do the different grades, okay? So I want to be making sure that these are aligned, very similar to the anterior drawer test, and that's what I would push in for the posterior capsule for the knee. Then for the anterior capsule of the knee, so what I'm going to do is, I would normally bolster the leg, and that's when I'm going to press. I'll press downward, and that will allow me to have better stability and not get tired as easily. But normally I also could do that same position as the anterior or the posterior capsule and just pull forward, but that just will fatigue much faster for me. So that's for the knee, and then can you sit up for me? And then I'm not going to use you anymore. Okay, so for the grades, I can't do it on a patient, but normally there are going to be 4 stages. So the first one, I would first feel all the way to the table, and that would be the amount of range of motion that they would have. And then the first grade would be just a small mobilization, small technique, and that would just be to the mid-range, or that would just be a little bit, so a very small range of motion. And then I would come back up. For the second grade, it'd be from the beginning all the way to about mid-range of motion, so just a little bit farther. That's the bigger range. And then the third one would be from the not here, but a little bit in, and then we'd go all the way to about right to that point of limitation, and then that's also a bigger range of mobilization. And then finally for the 4th one, I'm going to be sitting right at that point of limitation, just kind of hopping up and down. So what that would look like would be, in the 1st grade, it'd be like little like this. For the 2nd grade, it would be like this. For the 3rd range, it would be like this. And for the 4th one, it would just be sitting right there, so right at the end.